Hi, hope you're all doing fine. In this video, we'll discuss various important topics in periodontics, right? So based on the frequency of repetition of various topics in the recent entrances from 2011 onwards, right? So coming to the first topic. So in gingiva and tooth supporting structures, try to focus on the following subtopics. Keratins, which are specific to different types of cells, asked in AP 2015. Principal fibers of periodontal ligament, asked in AP 2014, and also cells of periodontal ligament, Comet 2016. Various characteristics of gingiva, AP 2014. Keratinization of gingiva, PGI 2014. Call, Kerala 2016. Periodontal ligament fibers and the forces they resist, Kerala 2016. Keratinocytes and non-keratinocytes. Various age changes in PDL, asked in Comet 2004, and Birbeck granules, asked in AP 2015, right? So these are some of the important topics which you can focus on in gingiva and various tooth supporting structures. And then we have an elaborate list, right? So see, if in case you find it difficult to listen to the entire video at a stretch, right? So make sure that you pause the video, take a break if necessary, right? But the most important thing is try to enter all these important topics, right? So that when you're referring our synopsis or my videos, then you can focus on these particular topics in specific, right? So make a note of these points simultaneously. Now, coming to periodontal microbiology. So try to focus on plaque composition, Comet 2015, specific plaque hypothesis, Ames 2014, primary colonization of plaque, Ames 2014, supragingival plaque, Ames 2013, subgingival plaque, Karnataka 2013, composition of a 1-week-old plaque and 3-week-old plaque, PGA 2014, co-adhesion, AP 2016, and microbial virulence factors, right, AAPG 2015, right? So these are some of the topics from periodontal microbiology. Now coming to defense mechanism of gingiva and host response, composition of GCF, Comet 2014, glucose levels in GCF, methods to collect GCF, and also various antibiotic levels in GCF, asked in PGI 2013, cell mediated immune reaction in periodontitis, Ames 2013, Cox postulates and Sokransky's criteria, Ames 2013, various cells producing prostaglandins, PGE2 in specific, and enzymes in GCF, AP 2015, right? So these are from defense mechanisms of gingiva and host response. Now coming to calculus and iatrogenic diseases. So you need to focus on the following topics, which include calcocementum, GSET 2014, and material alba, Kerala 2016, vitamin deficiencies and their associated periodontal manifestations, Kerala 2016, right? And then coming to gingivitis, the topic gingivitis, try to focus on the various stages of gingivitis, since we have a lot many questions from this in AAPG 2014, Comet 2014, etc. Pregnancy gingivitis, Ames 2012 and AP 2015. Atypical gingivitis, GSET 2014, various cells in acute and chronic gingival inflammation, Ames 2014, right? Now, coming to gingival enlargements, periodontal abscess in diabetic mellitus patients, Comet 2014, drug-induced gingival enlargements, Comet 2014, synonyms of periodontal abscess, Comet 2015, chronic discomative gingivitis, Kerala 2016, idiopathic gingival enlargement, AP 2016, inflammatory hyperplasias, which include parvulus, pyogenic granuloma, fibromas, etc., Kerala 2015, gingival enlargement in leukemia, Comet 2014, conditioned enlargement of gingiva, Karnataka 2013, right? So these are some of the topics from gingival enlargements. Now coming to acute gingival infections. Acute necrotizing ulcerative gingivitis, AP 2015 and MHZ 2015, desquamative gingivitis, PGA 2014, pericoronitis, Comet 2013, trench mouth, Comet 2013 and NEAT 2013, Vincent's angina, AP 2013, Noma, BHU 2012. Now coming to periodontal pocket. So in periodontal pocket, we have questions from retrograde periodontitis, Comet 2014, suprabony pockets, GSET 2014, infrabony pockets, Kerala 2016, true periodontal pocket, AP 2014, right? Now coming to patterns of bone loss and trauma from occlusion. So primary and secondary trauma from occlusion in Karnataka 2013, radius of action of various toxins, MS set 2015, histologic features of trauma from occlusion, AIMS 2012, changes in periodontal ligament in response to increased pressure, AP 2015, osseous craters, PGI 2013, angular defects, AP 2016, periodontal disease progression. We have random burst model and asynchronous multiple burst model, asked in AP 2016, buttressing bone formation, PGI 2013, right? So these are some of the topics from patterns of bone loss and TF4, trauma from occlusion. Now coming to slowly progressive and aggressive periodontitis. So clinical features of aggressive periodontitis and radiographic features of aggressive periodontitis asked in KSET 2012 and Comet 2016 respectively. Effects of diabetes on periodontium, Karnataka 2013. Periodontal diseases associated with neutrophil disorders, Karnataka 2013. Drugs for refractory periodontitis, AAPG 2014, and various drugs for juvenile periodontitis, Comet 2014. And linear gingival erythema, AAPG 2014 and AP 2016. Precocious periodontitis, which is seen in young children, PGI 2011. Juvenile periodontitis, AAPG 2015, right? So these are from slowly aggressive and slowly progressive and aggressive periodontitis. Now coming to diagnosis, prognosis and treatment plan. To try to focus on the various characteristics of gingiva, methods of clinical identification of gingiva from normal to abnormal, specific color and pathology, asked in AP 2014. It's not color, it's order. So specific order and pathology. So we have different orders depending upon the systemic condition. Like for example, uncontrolled insulin dependent diabetes mellitus, we have the smell of rotten apples, right? So kidney disorders, we have fish order, liver diseases, sulfur order, etc., right? So different orders and their associated systemic pathologies, right? So try to focus on that. And classification of tooth mobility given by Miller in Karnataka 2013, bone sounding, AIMS 2014, various indicators for tooth mobility, Kerala 2016, and different phases of periodontal therapy, Comet 2016, right? Now coming to periodontal instrumentation, try to focus on the objectives of polishing, instruments for curating furcation area, PGI 2013, hose scaler, PGI 2013, ultrasonic scalers, Kerala 2016, and the wavelength of diode laser asked in AAPG 2015. And from plaque control, various brushing techniques for periodontal patients, and in general the brushing techniques asked in PGI 2013, and brushing techniques for periodontal patients asked in AIMS 2012. Interdental brushes, AAPG 2015 and AIMS 2014. ADA specification for toothbrush design, Karnataka 2013. Disadvantages of chlorhexidine, Karnataka 2013. Techniques of flossing, asked in PGI 2013. We have the spool method and circle or loop method. And full mouth disinfection therapy, PGI 2014. Hawthorne effect, HAWTHRONE, Hawthorne effect, asked in Kerala 2015. And Charter's technique, Comet 2016, and as I said, different brushing techniques also. Hawthorne effect is nothing but the effect which occurs when research subjects behave differently because they realize that they are being observed. So when you're trying to do research on patients, when you compare different subjects, right? So they start behaving differently after realizing the fact that they're being observed or they're under observation. So that effect is called as Hawthorne effect. So the results will be skewed, right? Now, coming to gingivectomy and curettage. So, gingivectomy and curettage, try to focus on different techniques for gingivectomy asked in AP 2013, various indications and contraindications of gingivectomy, and disadvantages of electrosurgery. We have questions from these areas. And flap and mucogingival surgeries, try to focus on apically repositioned flap, AP 2014, Tarnow's technique, Comet 2013, free gingival graft, Comet 2013, undisplaced flap, AP 2013, and various image-based questions on different types of sutures asked in AP 2015, especially, the question was related to distal wedge suture. right? So it's an image based question. And variations in free gingival graft techniques, MHSET 2015, guided tissue regeneration, MHSET 2016, and full thickness and partial thickness flap, AAPG 2015. And penultimate topic, treatment for furcation involvement in osseous surgeries. So autograph, we have a question from that in MHSET 2015. RGD motif, it's a tripeptide of arginine, glycine and asparagine, and it's mainly used, or it's mainly present in extracellular attachment proteins like fibronectin, right? So we have one question on RGD motifs, right? And also, various stages of tissue response to increased occlusal forces, asked in GSET 2014. Allografts, AP 2014. Osteoconduction, GSET 2014. Repair and regeneration, asked in MHSET 2014. Dean's intraseptal alleloplasty, Kerala 2016. And last topic, we have implants. So implants, we have questions on implant failures, asked in PGI 2014. Hydroxyapatite coated dental implants, Comet 2016. Non-invasive way of evaluating implant stability, AP 2016, that is period test, right? So these are some of the important topics which you can focus on, different topics in periodontology, right? So regarding the weekly schedule and regarding the books for reference, we'll try to cover that in the next subsequent video, right? Hope it's clear.